Good morning. My name is Dr. Raja Adnan Ahmed, and I'm a consultant psychiatrist currently working in UK. And with me this morning is Dr. Monisha Mishra. Monisha is a IMG from India who came to UK in 2018, and then initially she did a job with medicine, and then got her foundation competencies, and then she started a psychiatry core training in February 2020, and she has just completed her CT1 in psychiatry. And this interview, I requested Monisha to come in and speak to me about it because a lot of IMGs are asking us that what is life like as a core trainee, and what is core training like for an IMG, and how working pattern is in psychiatry. I think she would be a very good person to share insights. So some of you might already know Monisha because she is already very active on the social media. She has got her own YouTube channel where she share experiences of working in psychiatry and also working in the UK. So if you are not following her, please do. Her videos are very informative and useful, and she's also very active on Instagram as well. I'll share the links of these two things with my video. So first of all, Monisha, thank you very much for joining me and giving us your time.
Well, thank you for having me. I'm very excited about this.
So Monisha, I'll ask you some of the questions which the IMGs normally ask us. I'm sure you were getting the similar questions as well. Um, I thought if we make a video, maybe we'll be able to answer the most common ones.
Mhm.
So the first one, if I ask you, how are you finding psychiatry training?
Um, I'm quite enjoying it. I've been 1 year into co-training, so I've just moved on to CT2, and my first year was very, very interesting. And especially given that, the pandemic had a role to play in it as
Hmm.
well, I still felt like that I still got a lot of hands-on mental health things to do, along with a lot of physical health stuff given the pandemic. Um, I quite like psychiatry because I feel like when it comes to physical health, we are so caught up and so busy just sorting out things that you lose the essence of, having a chat with another human being, sitting down and having a talk with them, which somehow gets lost in other specialties. And so that was my main reason why I chose psychiatry. I didn't want to forget that bit of being a doctor that, you want to know your patients, you want to talk to them. So given that, I'm quite loving it. I'm enjoying it. I like that, in UK you've got like there's a system in place. I keep saying this all the time in all my videos, but there's such a system in place. So there is a structure in which you learn things as well. And yeah, I love it. So yeah.
I think that's a very good insight. I think one of my trainees said to me once that psychiatry is the only specialty which doesn't have a counterpart in veterinary medicine. So that
Mm.
makes you really tells you that this is really what makes you human beings, and it's especially focused on human beings.
Yeah.
Um, so, how did you adjust to psychiatry as an IMG? Because that is some what a lot of people are concerned about that. Because if they haven't done psychiatry in UK, they think the whole is always a cultural aspect to psychiatry as well, and they find that they may not be able to adjust to it very quickly. How did you find that?
I had also not worked in psychiatry prior to applying for co-training and getting into co-training. So I felt the same that, I've got no experience. I had not really worked in psychiatry even back home in India. I did, those few weeks you do in your internship. And other than that, I didn't have any experience. So I had the same fear that given it's a new healthcare system and mental health is completely different to how the system works completely, physical health hospital over here. I felt the same, but honestly, looking back now, I think, I mean, how do I say it? If we pick up anything new in our life, we are going to be scared for it. But in psychiatry, I felt like the whole team, they're quite understanding of the fact that you're new to the system or if this is the first time you're working. And a lot of times, even other trainees who begin have not worked, even if they're from UK, they've not worked in mental health previously, and they do well also.
Mm.
So you probably wouldn't be the only one who's not worked in, mental health prior to starting core training. There might be other doctors as well who are not IMGs but haven't worked too. Um, the environment is very supportive, and the consultants are really nice. It would usually be just you and your consultant on a ward, so you get a lot of attention, in when it comes to academics from your consultant, and they are there to monitor you. If you let them know from first day onwards that this is the first time I'm working in mental health and I haven't worked in psychiatry, they're very understanding of that. They're not going to say that, oh, you should have done something previously, why didn't you do it or something. I did apply for 1 week of shadowing before doing core training, but unfortunately I fell ill during that week, so I did not have any experience either. So, but it'll work out. Yeah, with mental health, you've got good team and they're very understanding.
And I agree with you when you say, you see, this is you won't be the only person starting in psychiatry for the first time. Psychiatry teams are quite used to people, especially IMG starting there. Like, for example, I can give you an example from Wales. At least 70 to 80% of the workforce of psychiatrists, including junior trainees, are IMGs. So they are quite used to the teams, and the hospitals are quite used to IMG starting. And also, there is no requirement for you to actually work as in psychiatry prior to starting core training. You can have no experience in psychiatry, like same like Monisha. I didn't have any experience in psychiatry when I started my core training, and you don't need your MRC Psych exam to actually start in psychiatry. Most people do it after they have got the job. I can see you enjoy that a lot. It's very clear from your social media posting as well that you are actually enjoying it. But what aspects are there in psychiatry which you particularly enjoy, which you think you wouldn't have probably gotten in other places?
With psychiatry, I feel I get a lot of time on my hands to talk to a patient. When we clock in a patient, we take hours at the first time when we are seeing them. I don't think I would have been able to do that if I was in physical health, and that's something I really cherish in psychiatry, that I get to spend that time with the patient and get to know them better, and that relationship you build with them, it's quite special or important to me somehow. I like that. Um, so I like that bit of psychiatry, that I get a lot of time to spend with my patients, and also that when in psychiatry, it's not just mental health we're dealing with, that people forget that we do deal with physical health as well. So sometimes it's a good balance in a way. Being a junior doctor on the ward, you are dealing with physical health things as well. So you're not losing touch of physical health. And at the same time, you're getting, the opportunity to do mental health and physical health, somehow that you wouldn't be doing if you were only in physical health. I like the whole bit that there is such a nice feeling of being a part of a team. And it's usually not just a doctor and a nurse. I mean, there are so many other people involved in the team, and there are so many other people from different job roles. And I quite enjoy that. And I wouldn't have probably talked to an occupational therapist, sat down and had a chat, or, even a psychologist. It's quite nice to get there inside. And sometimes they pick on things you don't pick on, and it's nice. And also in psychiatry, I feel like there are so many layers to a person's life that you get to know about. And it's like a story, like you're watching a movie. I mean, I shouldn't say it that way, but all the things that have led up to this, and I find it quite interesting to have a chat with people about it, and then get to know deeper what happened exactly. And yeah, so I like that about psychiatry.
And one of the commonest things which I've been asked from IMGs who are interested in psychiatry, I'm sure you got the same question. Then, what is the routine day like as a junior doctor? In practical terms, when you go to the hospital, what are you really doing?
So usually the normal shifts are 9 to 5. So from morning 9 to 5 would be a normal working day. And then you have on calls that would be night 9 to morning 9, and then, or it would be a long day from morning 9 to night 9. You on a regular day, you do your, I'm on a acute ward. So usually our mornings begin with MDT, where we have a handover with the nursing staff and other people who are part of it, and we hand over patients and we discuss what's happened overnight or over the weekend. So that takes up morning at least an hour and a half, and then we begin with ward reviews through the week. So you would be sitting with probably a consultant, or if there's any other junior doctor on the ward, and you would be reviewing patients and see how they've progressed and things like that. At the same time, you also would be looking after the mental health. So if there's any blood tests coming up, or if there's, a new patient, you do the ECG or bloods. So as a junior doctor, a lot of times you would be doing physical health stuff when you're beginning, at least. And as the time progresses, then if your consultant's nice, they would let you, sometimes be the boss during the ward reviews where you can review the patients as well. So other than that, you would say if a patient is almost close to discharge, then you would look into, their housing situation and where they're going to. We have a couple of forensic patients on our wards currently they're low risk. So you would sometimes even be probably talking to the probation officer. So things like that. You only take up things that you're comfortable doing. If you're handed over something to do which you're not happy to do, you can always let somebody know that I've never done this. This is my first time, either let me know how to do it, or if you can do it and, I'll do it some other time. So it would be, jobs to do for a junior doctor, which anyway would be also, if you're on a physical health ward, most of them would be the same things other than a bits and pieces of mental health jobs. Yeah.
Okay. And on-calls, a lot of people worry about the on-calls in psychiatry. What are they like?
So the on-calls, again, would be mostly, to be honest, are physical health bits, because you're out of hours doctor, and the mental health nurses are quite equipped to handle the psychiatric emergencies and things like that. So it would be either a medical emergency that you're called in to, see a patient who's acutely unwell, or it would be a new patient who's come in and so you need to plug them in, or, out of hours prescriptions and things like that. So the on-calls would have more or less physical health and mental health jobs, but mostly physical health.
Okay. I must say that on-call might work differently in different areas, and some areas, the junior doctors are actually seeing the crisis patient with the crisis teams and reviewing them, the patients who are being referred from the GP or accident emergency. But then some other places, they are crisis team who are actually doing that without junior doctors. So it varies around in the different parts of the country. So one of the things, another thing which is asked quite commonly, what level of support did you get from your seniors? And as you've been mentioning about your team, that you like playing part of working with the team. What level of support do you think you get from them?
I quite enjoy the team I'm currently with, and my consultant's really nice. So he's very particular with, my weekly supervision. So no matter what, he always reminds me, oh, so today is a Wednesday, we need to do supervision. So I no matter what, I've got very protected supervision time every week. And also when I started out, this is my second rotation that I'm still on. I'm supposed to be on a third rotation, but because of the pandemic, we've been asked to stay back in our rotation. So I'm still on my second one. So when I started out in my first rotation, I also had another co-trainee with me, and she had past experience of working in mental health. So she was very nice to me. She helped me out with a lot of things that I did not know of. And people are very supportive. All that they expect you to say is that you don't know it, and they'll help you out instead of being like, oh, well, let me just figure this out by myself and make a mistake. But so people are very nice and very helpful.
I think I will mention here is the thing you mentioned about supervision, which is actually quite unique to psychiatry. Supervision means that, when you are trainee, you're supposed to have 1 hour of fixed time every week with your consultant where you can sit down and talk to them about any issues. Usually the supervisions we say that it should be led by the trainee, so their training needs or training issues or any sort of issues. So, one-to-one time with your consultant or your senior once a week, that is something which has been part of psychiatry training for a long time. And this is something, when trainees come to us from other specialty, they might say to you, I've never had that exclusive time with my senior where I was just me and him sitting and talking about something about my training needs. So this is something psychiatry trainees enjoy a lot. Did you have good experience with that? Sorry, yes.
Sorry, go ahead. Yeah.
No, I was going to ask you, did you have, what is your experience of one-to-one supervision?
I think it's very useful because a lot of times, a few cases or few, experiences during on-calls just stay back with you if you've had a rough time or, rough experience with someone or a tough patient that has just stayed on your mind. It's very good because you can discuss those things or, things you are not unsure of, and you can ask your consultant during that time. Or you can, if you don't have anything that is worrying you, you can probably bring up an interesting case you've seen on the ward or on your on-call and discuss that too. So I quite enjoy my supervision times. And It is trainee led, and it's quite informal. It's not a formal teaching where you're getting lectured on something. It's not like that. So I quite like that. And also we have every weekly once we've got something called the balance groups, where with other trainees, it's a consultant who supervises that session, and it's your entire cohort of doctors. You sit and talk about any. It's the same way how you have your supervision time with your one-on-one consultant, but it's just that you get an kind of different advices from your other colleagues and everything. So that's another thing that is, I think, quite specific and special to psychiatry, I think, Valent
Yeah,
Group.
that's right. Yeah. Um, one of the common question again from IMGs is, they say to me, I'm sure you get the same, that they are interested in psychiatry, but they have no experience of psychiatry. Sometimes not even back from back home. I think you already touched upon that. And I always advise them, you see, it is still possible that psychiatry training, a core training, could be your very first job in psychiatry, because I did it when I came to UK as a very first job. What would you advise to them is if they have no experience and they're anxious about, although they like it, but they're anxious about actually psychiatry core training being their very first job?
Um, I think give it a shot, because the chances are that you will enjoy it. Even and it goes for any other specialty. If you say that, if say you want to do, say, even medicine or surgery, chances are that you probably wouldn't have done, a job in that physical health specialty either. When, at least if you're an IMG and you're moving to UK, so I don't see the difference, if how it would be any different for you to not have worked in surgery and choose surgery here, and if you've not worked in psychiatry and choose psychiatry. So and the team, like I mentioned, usually they're really nice, they're very supportive, and there are so many um, things in place to look after a trainee in psychiatry, like the balance groups and the supervision thing. You don't get any of that in any physical health specialty. It's not, your time is not as protected in other specialties. So you're really looked after and you're cared for. So even if you've not had experience, I think people will survive survive it.
Okay.
Yeah.
So thank you very much, Monisha, for sharing your insights and experience in psychiatry. I'm sure it will help a lot of IMGs and other doctors who are thinking about psychiatry. I just like to say, Monisha has already shared her experience of getting into core psychiatry training and how she made her portfolio and all of that. However, the recruitment process keep on changing, especially during the COVID time. Right now, we're recording this interview in February 2021. The recruitment currently happening is only via the MSRA exam. So it might change in the future, and you might have to go back to Monisha's videos to see how she was making a portfolio and how she was showing her commitment to psychiatry, and that might be brought back for the recruitment process. But again, thank you, Monisha. Thank you very much for your time.
No, thank you so much for having me, and I hope this was useful for anybody who's watching it. So yeah, don't worry, choose psychiatry.
Thank you.